Hi everyone. Welcome to another lecture from my channel. I am pharmacist Dr. Ezeudo Nwaozuzu. Today, I will discuss another important issue that affects our health. Covid-19, specifically the Covid-19 Omicron variant. If you haven't subscribed to this channel, kindly do so now and activate the notification bell, so that you don't miss any future videos from this channel. Thanks for your support as you watch, like and share my videos, and as you subscribe to the channel as well. Now, let's go on with our topic for today, the Covid-19 Omicron variant. History. This is a new variant of Covid-19, which was recently detected in Botswana on the 11th of November 2021, and in South Africa on the 14th of November 2021. The first United States case was detected on the 3rd of December 2021. Here in Nigeria, the first case of the Covid-19 Omicron virus was detected on the 1st of December 2021. The discovery of this variant was reported to the World Health Organization on the 24th of November 2021. On the 26th of November 2021, the WHO designated the new variant as a variant of concern and named it Omicron, on the advice of its Technical Advisory Group on Virus Evolution, TAGVE. The decision to do these were based on the evidences that Omicron has several mutations that may have an impact on how it behaves, for instance, on how easily it spreads, or the severity of illness it causes. Presently, researchers in South Africa and around the world are conducting studies to help us better understand the new Omicron variant of Covid-19. We will continue to share their findings with you all as they become available. To receive these information and future information on healthcare and other issues from this channel, just click on that red subscribe button below and the bell button beside it and select the all option. That way you will always be notified of future videos from this channel. Meanwhile, you can also check out the various healthcare, lifestyle etc. videos on the channel. Thank you. Now back to our present discussion on Omicron. Symptoms of the Omicron Covid-19 variant. The most common symptoms of the new Covid variant Omicron are fever, cough, tiredness, loss of taste or smell. Its less common symptoms are sore throat, headache, aches, pains, diarrhea, a rash on skin, discoloration of fingers or toes, red or irritated eyes. Serious symptoms of the Covid variant Omicron are difficulty breathing, or shortness of breath, loss of speech, or mobility, confusion or chest pain. Note that, if anyone has any of these symptoms, then he or she should urgently take the Covid test. Transmission. It is not yet clear whether Omicron is more transmissible, that is, whether it is more easily spread from person to person compared to other variants, including Delta. However, the number of people testing positive has increased in the areas of South Africa affected by this variant, but epidemiologic studies are underway to understand if it is because of Omicron, or other factors. List of countries where Covid-19 Omicron variant has been detected. As at today 5th of December 2021, the Omicron variant has been found in more than 23 countries of the world, and still rapidly spreading to many more countries. These countries include 1. Botswana, 19 cases. 2. South Africa, 77 cases. 3. Nigeria, 3 cases. 4. United Kingdom, 22 cases. 5. South Korea, 5 cases. 6. Australia, 7 cases. 7. Austria, 1 case. 8. Belgium, 1 case. 9. Brazil, 3 cases. 10. Czech Republic, 1 case. 11. France, 1 case. 12. Germany, 9 cases. 13. Hong Kong, 4 cases. 14. Israel, 4 cases. 15. Italy, 9 cases. 16. Japan, 2 cases. 17. Netherlands, 16 cases. 18. Norway, 2 cases. 19. Spain, 2 cases. 20. Portugal, 13 cases. 21. Sweden, 3 cases. 22. Canada, 6 cases. 23. Denmark, 4 cases. As compared to other variants, Omicron has an increased risk of reinfection and has more number of mutations, according to the WHO disease severity. It is not also clear whether infection with Omicron causes more severe disease relative to infections with other variants, including the Delta variant. Initial data available to us seem to suggest that there are increasing rates of hospitalization in South Africa, but this may be due to increasing overall numbers of people becoming infected, rather than a result of specific infection with Omicron. There is currently no information to suggest that symptoms associated with Omicron are different from those from other variants. Initial reported infections were among university students, younger individuals, who tend to have more mild disease, but understanding the level of severity of the Omicron variant will take a little while. All variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe disease or death, in particular for the most vulnerable people. Therefore, as always, prevention is the best way out. Reinfectivity. Available preliminary studies seem to suggest that there may be an increased risk of reinfection with Omicron. In other words, people who have previously had COVID-19 could become reinfected more easily with Omicron, as compared to other variants of concern. We will know better in the next couple of days or weeks. Watch out for more information on this channel. Vaccine efficiency. The World Health Organization, WHO, is working with technical partners to understand the potential impact of this variant on our existing countermeasures, especially vaccines. Vaccines are inevitable in reducing COVID-19 disease severity and death, including against the dominant circulating Delta variant. Current vaccines remain effective against severe disease and death. COVID-19 tests. The widely used PCR tests has continued to detect infection, including infection with Omicron, as we have seen with other variants as well. Further ongoing studies will hopefully help us determine whether there is any impact on other types of tests, including rapid antigen detection tests. Effectiveness of current COVID-19 treatments. Corticosteroids and IL-6 receptor blockers will still be effective for managing patients with severe COVID-19. Other treatments are currently being assessed to see if they will still remain effective with the Omicron variant, considering the changes to parts of the virus, compared to the previous variants. Recommended actions for countries. While the World Health Organization continues to collaborate with a large number of researchers around the world, to better understand the Omicron COVID-19 variant, its transmissibility, severity of its infection and symptoms, performance of vaccines against it, effectiveness of its diagnostic tests, and effectiveness of treatments for it, it recommends the following interim interventions for every country in the world. 1. Every country should contribute to the collection and sharing of hospitalized patient data through the WHO COVID-19 Clinical Data Platform to rapidly describe clinical characteristics of the infection and patient outcomes. 2. Enhance surveillance and sequencing of cases. 3. Share genome sequences on publicly available databases, such as Ezeudo. 4. Report initial cases or clusters of the variant to the WHO. 5. Perform field investigations and laboratories assessments to better understand if Omicron has different transmission or disease characteristics, or impacts effectiveness of vaccines, therapeutics, diagnostics or public health and social measures. 6. Countries should continue to implement the existing effective public health measures to reduce COVID-19 circulation overall, using a risk analysis and science-based approach. They should increase some public health and medical capacities to manage an increase in cases. The WHO is providing countries with support and guidance for both readiness and response. 7. Also, inequities in access to COVID-19 vaccines should be urgently addressed to ensure that vulnerable groups everywhere, including health workers and older persons, receive their first doses, second doses and booster doses, alongside equitable access to treatment and diagnostics. Recommended actions for individuals. The most effective steps individuals can take to reduce the spread of the COVID-19 virus includes 1. Keeping a physical and/or social distance of at least 1 meter from others. 2. Wearing a well-fitted mask in public always. 3. Opening windows to improve ventilation. 4. Avoiding poorly ventilated or crowded spaces. 5. Keeping hands clean by washing and sanitizing them frequently. 6. Coughing or sneezing into a bent elbow or tissue when the need arises. 7. Getting vaccinated as soon as possible. Thank you for listening and God bless you. The script of this lecture is also available in the description of this video below. Feel free to check it out. We hope you learned something from this lecture. If you did, kindly like and share this video. Also support this channel by clicking the subscribe button, as well as the bell button beside it, and select all from the options. That way, you will be notified of any other video we publish on this channel. Remember that this is a computer-modified audio version of this video, made to ensure that our audience in different parts of the world can hear and understand the lectures. The original audio version from Dr. Ezeudo is also available on request. Just subscribe to the channel and make your request in the comment section below, and you will receive it. Till we come to you again, with another interesting video, we wish you the best in your business ventures. Bye for now, and see you in the next video.